Good afternoon, everyone. Welcome to the Embrace Multicultural Mental Health webinar. This afternoon, we're speaking on the framework for mental health in multicultural Australia, and we're featuring frequently asked questions. We're going to wait another 30 seconds for everyone to join us, and we'll start soon. All right, we might start. So welcome again, everyone, to this afternoon's webinar. I'd like to introduce myself. My name is Ruth Das. I'm the Partnership and Engagement Lead for the Embrace Multicultural Mental Health Project. And I'm joined here by my colleagues, Crystal Halbmeyer, Samantha Lilly and Aruj Hanifi. And we're going to be spending the next hour together talking about the framework and some commonly asked questions. First of all, I'd like to start the afternoon by acknowledging the traditional owners of the land that we're all meeting on today. We'd like to acknowledge the First Nations people as the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to all elders, both past and present, and express our support to Voice, Treaty and Truth-telling. We'd also like to acknowledge the unique contribution of all people with lived experience of mental ill health and those who love and care for them in championing mental health reform. We celebrate people of all backgrounds, genders, sexualities, cultures, bodies and abilities. So just before we get started today, just a few housekeeping matters. Today's webinar is being recorded and the recording will be made available on our website in the coming week. The participant chat is disabled, but we do welcome your questions and we will have a good chunk of time at the end of our presentation today to answer your questions. So if you would like to ask a question, I'd ask you please to use the Q&A function, which is at the bottom of your screen, where you can type in a question. There you can also vote for a question, which gives us a sense of how popular a question might be and what we can prioritise in our session. You can click on the thumbs up to any of those questions, which will help us prioritise them. Also, just another point to note, at the end of today's webinar, there will be a feedback survey and that will pop up on your screen. So if you can please just take a couple of minutes to complete that survey, that will help us very much. Thank you. So today, the purpose of our webinar is to provide an overview of the framework for mental health in multicultural Australia, provide guidance on how you can implement the framework, and answer frequently asked questions about the framework. And I'd just like to highlight at the start of the webinar that this webinar is for mental health services in Australia, community organisations and practitioners, primary health networks, to work more effectively in a multicultural context. So if you are a consumer or a carer, you're welcome to stay and listen to the webinar, but just to acknowledge that the webinar purpose is primarily for service providers.
So on our Embrace website, we have developed a document of frequently asked questions about the framework. Sami will also be sharing a link to this document in the chat. Some of the questions that we frequently receive are, how is the framework different to other cultural competency tools? How long will it take to complete the framework? How will the framework benefit my organization? Why do we need the framework? How does the framework relate to quality improvement? And are the results and information supplied confidential? Throughout the webinar, we will be addressing all these questions during our presentation, and we will also be touching upon some of the other queries we've received during our registration. You will also have the opportunity to ask questions through our Q&A function, so please feel free to use that. Thank you.
So just as a way to provide some background and some context for the conversation today, I guess it's really important to acknowledge upfront why cultural responsiveness is important for mental health services. We know that we are a very multicultural nation, and almost half of Australians were born overseas or have at least one parent born overseas. We know that people from multicultural backgrounds, migrants and refugees, don't have reduced needs in terms of mental health, but they do have reduced service access. We know that it's a particular safety and quality issue for mental health services. There are risk and protective factors which are unique to people from migrant and refugee backgrounds. And we know that people from refugee and asylum seeker backgrounds are at greater risk of developing mental health problems and suicidal behaviours than the general population. So why is this important for us? We want everyone in our community to be able to access support and information about mental health, and that should be available to everyone. We know that there's stigma, cultural meanings, and barriers to discussing mental health and illness in particular communities. Some of the research that the Embrace Project has commissioned has reinforced what these issues are, but there's a growing body of evidence to demonstrate this. Often our mental health services take a Western biomedical model, which may not always be suitable for people from different cultural backgrounds. And we know that services, need to be flexible to be able to provide cultural responsiveness. So into thinking about the services that we deliver, what change do we want to see? We want to see services that are responsive, that are adaptive, and that are tailored to the needs of our clients and our community. We want to see community attitudes and belief embrace positive mental health and help-seeking behaviours amongst multicultural communities. We want to see reduced stigma around mental illness in our communities. We want positive mental health and well-being for everyone in our multicultural communities. And the principles that we want to incorporate are co-design, so working alongside people to find what's going to best suit them and their needs. And that includes collaboration and shared authority and power sharing. We want to provide services that are person-centred, not service-centred. We want to provide, we want our services to be culturally informed and evidence-based. We want to have flexible engagement with our communities. And we want to have proactive outreach to different communities. We want to take an approach that includes a whole of organisation approach to change, not just on an individual level, but on a whole organisation level. So I'm going to move now just to quickly give you a snapshot overview of what the Embrace project is for those of you who might be new to the project. We're funded by the Australian Government Department of Health and Aged Care. We provide a national focus on the mental health and suicide prevention for culturally and linguistically diverse communities. We aim to improve the cultural responsiveness of mental health services in the workforce, and the primary tool we use to do that is through the framework, which we'll talk about today. We also want to increase the mental health awareness, literacy, and capacity amongst migrant and refugee communities. So really there's two main arms or aims to the project. One is to strengthen the cultural responsiveness of mental health services, which is what we're focusing on today. And secondly, to strengthen the mental health of migrant and refugee communities in Australia. So today we're focusing on the first one of those aims through the framework. So the framework is housed within the Embrace website, which is a hub of information, resources, translated materials, best practice examples, policies, and case studies to support services and multicultural communities. So as I said, the framework is housed within the Embrace website. So if you look at the image on the screen, you'll see up on the top that one of the tabs is for the framework, which is where you can access the framework through the website. The website has two arms which are aligned to our two aims: the community side, which is the purple ribbon at the bottom of that image, and then the service provider side, which is the aqua ribbon on the bottom right-hand side of the screen. So if you haven't had a look at the Embrace website, I really encourage you to do that now. We will also put the link to the website in the chat so you can have a look today. So as I mentioned, there are two really distinctive sides to the website. The community component has lots and lots of information for community members, personal stories from our lived experience group, a lot of multilingual information about mental health services and where to access those in different states and community organisations. And then on the service providers side, which is for mental health services, there is the framework. So you can also access the framework through the service providers component of the website. And we have lots of other resources there, personal stories again. We have some policies, we have a knowledge hub, and we have lots and lots of resources for service providers on that side of the website. Some of those you can see here. Some of our personal stories are video recordings from members of our lived experience group. And there's some examples there of our translated fact sheets, which are available in 19 different languages and are ready to be downloaded and used whenever you would like to. So I'm now going to shift focus directly onto the framework for mental health in Multicultural Australia, and we'll move into some of those frequently asked questions that Aruj mentioned earlier. So first of all, what is the framework? I think of the framework as a scaffolding tool. It's a really comprehensive guide and provides direct guidance on how to measure and critique your service in terms of its cultural responsiveness. So I see it as a structure that is really designed to support you and your organisation to work more effectively with migrant and refugee communities. It's a free, nationally available online resource, and it's really great that it is free and it's available to anyone who's interested in improving cultural responsiveness. It's a quality improvement tool and it's mapped against national standards, so it is based on evidence and strong data. As I said, it supports mental health services and individual practitioners, primary health networks, and others to work effectively in a multicultural context. It consists of 4 tailored modules and 2 self-reflection tools. Its cultural competency standards and principles are transferable to other health settings within health. And so it is transferable, but it is designed specifically for use in mental health services. And lastly, it's self-paced and free access to all the resources that are embedded in the framework as well. So when you go into the framework, this is what the front page will look like. There's a welcome page. And if you see at the bottom of that screen there, there's the resource, which we mentioned at the beginning of the webinar, the frequently asked questions resource sheet. So if you, instead of taking notes today, all the information that you might need is addressed in that fact sheet. The next screen that you go into in the framework will ask you to register. So you'll see on the top right-hand side there is a user status. I've logged into the framework, so my option there is to log out. But if you are entering for the first time, you'll be asked to create a login and a username, which you can use to go into the framework at any time and then log out again. All the information that you put into the framework is saved, so it will be there ready for you the next time you return to the framework. You'll see there's a number of coloured tiles at the top of the screen, orange, blue, pink and green, and they're all really good information and background documents to the framework. There's a user guide, there's a background to how the framework was developed, there's a rationale on why cultural responsiveness is important for mental health services, and there's a summary of what's included in every module and the self-reflection tools. There's also a forum where you can post questions at any time that you're in the framework, and we'll endeavour to answer those questions once they're posted. And there's an option for discussions around particular topics if you'd like to talk to other people who are using the framework. There is an introductory module which we've put into the framework, which is provided by the Centre of Culture, Ethnicity and Health in Victoria. And that is an optional module, which we've put in because it gives us really good introductory information for people who are new to culture responsiveness and who may be unfamiliar with some of the concepts. It's only an hour module, and it's a really great overview of why cultural competency is important and some of the terminology and topics that are involved in that. Then we move into the 4 core modules. You'll see they're divided into 4 different distinctive topic areas: planning strategically to meet multicultural community needs. Number 2, developing safe, quality and culturally responsive services. Number 3 is working together to promote mental health in multicultural communities. And service module number 4, building a culturally responsive mental health workforce. So they're the 4 modules, and there's 2 self-reflection tools in addition to that. So in terms of the way the framework is structured, as I said, there's the introductory module, then there's the 2 self-reflection tools. One is for a mental health service, and this is really an abridged version of the framework. If you'd like to get an overview of what's involved in the framework, you can undertake the self-reflection tool first, and that might give you an indication of where you'd like to start focusing on in terms of the modules, which one you might want to start with. If you don't want to start from number 1, that's completely fine. You can just choose which module is most appropriate to your service. And then there is an individual self-reflection tool for individual practitioners, and that is a very quick guide on how you might want to reflect on your own cultural competency in your own practice. That's also provided as a supplementary resource within the framework. So the self-reflection tools, I've already mentioned there's 2 there. They're an opportunity to undertake a brief assessment of cultural approach of responsiveness, and they take around 30 to 60 minutes to complete. You'll see on the right-hand side, there's self-assessment levels that you can rate yourself within the self-reflection tool, and that again will give you a bit of an indication of where you might want to focus your attention. So the course service module process, first of all, there's an introduction to that particular module. Then you'll be guided to undergo the self-assessment, and there'll be different levels that you can rate yourself through that self-assessment. And the self-assessment process will really give you a very clear pathway into developing an action plan that is specific to your organisation. Then following the action plan is the implementation, and then there's an opportunity to come back and review your action plan, and if you like, do another self-assessment to see where you've progressed or where you might still need to do some work. So all over, the modules should take around 2 hours each to complete, depending on how much detail you want to go into the modules and how many of the resources you want to look at, and how intensive you want to undertake the process. So roughly 2 hours per module, and then the implementation is 3 to 12 months. And then when you come back to do the review, that's another 30 to 60 minutes. As we mentioned at the beginning, the modules are all self-paced. So if you don't have time to do the self-assessment in one sitting, that's completely fine. You can log out and come back at another time when you have another piece of time available to do that. So in terms of what the elements of the service modules are, they all have principles that describe what you're trying to achieve within that particular module. So for example, in this module number 1, the principle is around leadership and resourcing. And the principle is that the service has executive leadership that recognises the need for culturally responsive mental health service within their region with suitable resource allocation to embed a culturally responsive approach across all stages of service planning, delivery, and evaluation. So if you want more information about this principle, there are resources which are on the right-hand side. Any of those you can click into and provide examples that provide more information on this particular principle. Some of those are resources from lots of different organisations around Australia, examples of best practice, or things to give you ideas on how you can implement this particular principle. Then underneath that principle, there's indicators. So there's under this principle 1, there's a series of indicators, and as you click on each of those, it'll drop down a menu to describe what that indicator entails, and then you can rate your organisation under those levels there: pre-entry, starting out, developing, and advanced. And then as you rate yourself, you can then go back and fill in the action plan on how you'd like to move to the next level, what you're going to do to move to that next level. If you're unsure what that particular standard is, you can also click on, for example, developing, and it will give you a descriptor of what your service should look like if you're at that developing stage. So that's another point where you'll find some guidance on what your service should look like at each particular level and where you should be moving to for the next level. So if you think you're starting out and you think that that meets your description, then you might want to click on the developing level and see what you need to do to reach that next level. So it's all quite intuitive and very explanatory as you go through the process. As I said, you can start with any module. You don't need to go in order. The self-assessment is against the key principles and indicators. There's access to those free resources. There's guides available on the website if you need more information as you're going. And when you finish the module, your service or organisation will receive a certificate of completion after the module has been finished. So moving now to the Q&A section, who's the framework for? The framework is really designed for small and large mental health services, and it covers, as you will have seen, all aspects of service delivery, right through from prevention and early identification, right through to workforce planning. So it's suitable for all mental health services. Having said that, we have seen its applicability across other services as well. How is this framework different to other cultural competency tools that are available? Well, as we've said, it's created specifically for mental health services, so it is a tool that is aligned to the National Mental Health Standards and is specifically designed for mental health services. It is self-paced and it's mapped against those national standards. How long will it? Lots of people always ask, how much time do I need to give to the framework? And as I've said, it's flexible. You can do all 4 modules in one sitting and take a whole day for your service to sit down and do that if you've got the capacity. If you don't have the capacity, you start off with half an hour or an hour. It's really flexible and it's designed to be that way so that it can be used in a multiple of different settings. And we want it to be able to be taken up wherever it can be. Another question that we often get asked is, how will the results of the framework be used? Or how can I use the results? So as we've said, it really highlights areas for development, but it also highlights areas that you're doing really well in, and that's sometimes good to celebrate as well. It allows your organisation to have some really focused planning and identify some areas in particular that you would like to improve. It's a quality improvement tool and it's working towards progress. It's a continuing evolving progress. It's not something that you do once and it's finished. It's something that you need to keep evolving as your service develops. Why do we need the framework? I think it's really important because it gives us, as I said, that structure, the scaffolding, which turns up those principles into actions, which really fleshes out and embodies what cultural competence looks like on the ground. It allows organisations to develop detailed strategies. It's a process for assessing capability, internal capability, and what you can focus on to improve. and you can measure improvements that the service and the organisation is making. It also allows you to track over time in a clear action plan what you are going to do. And I think, again, I'll say quality improvement. We're always wanting to make sure that our mental health services are of high quality and are meeting the needs of our community. And this is a really good tool to do that. Are the results of the framework assessment confidential? Absolutely. They can't be accessed by anyone outside of the organisation. Mental Health Australia, through the Embrace project, will only access the results for reporting purposes. We won't be reporting on particular organisations on how they're going. We will just be using those results to say how many people are using the module and how many people have completed the modules. So what's involved in the framework? I think we've alluded to a little bit of this previously, but I just want to go through the modules so it fleshes out what's actually the content of each module. So we've noted that the first module is around planning strategically to meet multicultural needs. And the particular areas that will be honed in on in this module are leadership and resourcing. Underneath that is strategic plans, policies, language services policy, budgeting, and activating the framework. And then another key area for focus within this module is looking at data collection and research. So focusing on the local profile of the area that you work in, what sort of data you collect within your service, what sort of outcomes and satisfaction methods you might be using to measure whether service you provide is meeting the needs of the community, and then evidence and community networks. And finally, research and development within your particular service. So that's module 1. Module 2 really focuses on actual service delivery within your service. So this module looks at equitable access through language services practices, promotion of a service, how your service might do outreach into a particular community, how your service communicates rights and responsibilities, how people navigate your particular service, and the particular cultural needs of people living in your community. It also focuses on the nuts and bolts part of service delivery. So how does your service do assessment, provide treatment and support, and continued care to people from multicultural backgrounds? Module number 3 is really the health promotion module, or the early intervention module, and it focuses on consumer and care engagement and co-design. How does your organisation approach inclusion and co-design? What are some of the approaches that you use to community engagement? How do you remunerate and support bicultural workers within your service? How do you collaborate and work with stakeholders within your community? What sort of networks and representation is involved in your service? And then lastly, looking at promotion, prevention, and early intervention, what sort of mental health promotion activities and capacity building and particular target approaches your service might be using. Number 4 is around workforce development and how do we build a culturally responsive mental health workforce. So this module really focuses quite closely on professional development of your staff. What's the awareness and cultural competence of service of people within your service? What sort of courses or support do people receive in developing those skills? What sort of diversity and inclusion practices are engaged within your organisation? How do you recruit people to work within your organisation? Do you recruit people for particular communities from particular backgrounds? Do you have specialists? And how do you pay people, and what sort of pay is offered through your workforce? And then lastly, what sort of internal and external support does your service have for the workforce? So this again is looking at the progress levels in the framework, ranging from pre-entry, which is where an organisation is just starting out and has limited activity in this area, right through to advanced, where organisations are considered to be leaders in the field, and cultural responsiveness is integrated and embedded as core business. So you'll see there's a range of different levels there that you can assess your service at, and there's no right or wrongs. It's really just a way of mapping where your service is and where you'd like to move to next. Okay, I'm going to stop talking now and let you have the opportunity to ask questions. I'm going to hand over to my colleague Crystal, who will lead that session. Thanks.
Okay, good afternoon, everyone. So as we're waiting for more questions to come in, and we do have one that came in via just a private chat to us, so we'll start with that one. And please, as just a reminder, use the Q&A function at the bottom of your screen. And if you see a question someone else has asked and you also really want that one answered, please give it a thumbs up, because that'll help me triage the questions. So the first question that came in notes that the framework is very comprehensive, which is fantastic to hear. But it says we're a not-for-profit with limited resources. We don't have capacity to implement the whole framework, but we want to sign up. Do you have any advice?
Great question. Thank you. I think that's the one of the strengths of the framework is that it really is adaptable and can be tailored to where your service is at this present point. So if you don't have a lot of time or a lot of resources, absolutely start with one of the modules. If none of them stands out to you as something that you'd really like to focus on or something that you feel that you need to work at, it's really great to start at module 1, planning strategically to meet community needs. So I'd suggest start at number 1. The great thing about the framework, as I said, is it's free. The introductory module, we've already paid the Centre for Ethnicity, Culture and Health in Victoria for, so you don't need to pay for that if you access it through the framework. So the only resources you need are time and will to take the work on. So you can just bite off a little bit to chew on at the beginning. Just do one module and see how you go with that.
Fantastic. And then just some questions that came in through the registration as well. Can you touch on what are practical steps to implement the framework and relevance to organizations in related fields such as disability?
Yeah, I think some of the things that we recommend when in terms of practical steps is finding 2 or 3 or 4 or 5 people within your organisation to do the framework together. As I said, it's meant to be an organisational tool. So forming a working group within your organisation to do the framework modules together is really helpful. So we always also recommend that you get some executive support through your managers, and that really provides that structural support and for you to do the framework. So you might ask an executive manager to be part of that working group, or you might want to write a little mini proposal to your executive manager about why you'd like to do the framework as an organisation. You might want to do a presentation on some of the things you've heard today, or we're also happy to talk to your managers at any time about the advantages of doing the framework and some of the really great things we've seen change in organisations as a result of undertaking the framework. In terms of disability, yes, absolutely. There's a lot of links between disability and mental health. And one of our alliance partners, the National Ethnic Disability Alliance, is really on board with the framework, and they support the use in disability services as well. So absolutely, please feel free to transfer the framework into a disability setting.
Fantastic. And there's one question that's come in live through our Q&A, and it is the framework designed for students who are studying mental health? Yes,
absolutely. That's a great question. And I think we encourage all mental health practitioners to really prioritize cultural responsiveness as part of their care. And when you're studying, it's a great opportunity to learn. And the framework provides lots and lots of resources that are available for learning, reading, further investigation. So absolutely, it's very suitable to students.
Thank you, Ruth. Here's another one that came in through the registration process. So as a small organization, it is hard to implement detailed action plans on top of our existing work. Do you have any advice?
Sure. I think most services need to be accredited. And so the framework is aligned to national accreditation standards. And as you go through the framework, you'll see that there's linkages to national standards. So through the national mental health standards and also the national quality safety standards, all of the principles in the modules are aligned to those standards. So if you need to be accredited under those two national bodies, you can provide evidence for your accreditation through the framework, and you can provide evidence of what you've done to meet those standards by completing the framework.
Fantastic. Here's another one that's just coming through the chat, and it's can I participate in the framework at an individual level with a lived experience?
Of course, we welcome anyone looking and working through the framework. It is really designed for service providers and for mental health services to really refine and hone their cultural responsiveness so that all mental health services are really useful and meaningful to people when they seek support. So as a participant or as a consumer, you're welcome to look at the framework at any time. You might find some of the resources are really helpful, but as I said, it is designed for service providers and some people that we know who have lived experience of living with a mental health condition or caring for a family member. They actually use the framework as a tool to take to their service provider and say, there is this tool that's available, maybe your service might want to have a look at it. So absolutely feel free to have a look at it, but also feel free to recommend it to your service providers as well.
Great. And so one question is, does the framework provide cultural competency training?
Excellent question. So I think there's two distinctions that we need to make, and hopefully the framework structure really helps to define the answer to this question. So we see the framework as a scaffolding tool for services to provide a structure for their service to be culturally responsive. It's not actually a tool for me or other individuals to become more culturally responsive individually. It provides a guidance on how I can become more culturally responsive. So it's not actually a culturally competent training program. And part of the workforce module is that we ask services to describe what cultural competence training is provided to their staff outside of the framework. There's lots of different cultural competency training courses that are offered. I know there's some offered for if you work in an acute mental health service. There's some that are offered through multicultural health services at local health districts, but there are others that can be accessed as well. So for individuals, the answer is the framework doesn't necessarily address that. So that's something that is part of a culturally responsive service.
Fantastic. Great. What information is collected to provide any impact developed through participants, the accommodation or support services?
What information is collected?
Through the framework, I think, to gauge impact on the participants, on the services.
So I think the information that's collected through the self-assessment really gives organisations a point in time picture of where their service sits in terms of cultural responsiveness. As I said, either through the just starting out or through the advanced level. So it gives people a picture of how well along that spectrum their service might be in particular areas. It can really highlight, we're doing great in this particular principle, but this other principle here, we need to do some more work on. So it really allows services to pick which areas they might be needing to do some work on and work on in the future, but also highlight where they're doing really well and might want to continue building strengths on.
Fantastic. Can you touch on how do we use the framework in culturally sensitive ways dealing with multiple cultures?
Yeah, I think that's a really important question. And I think part of being culturally responsive is cultural humility, and that really is an approach of working with people where you're open to asking questions and to really being inquisitive and curious about what might work well for them. So every culture is different, every community is different, and within every community there's going to be differences as well. So having an open-minded curiosity is going to be the best approach to working with different communities. And we always note that one size doesn't fit all multicultural communities. And so this framework provides a structure and, as I said, some scaffolding points on how your service does the very best it can to make sure when people do come to your service that you have the skills and the systems and the structures and supports in place to be able to provide the best service possible to that person in their particular context.
Fantastic. One more question for any of our PHN participants on the line. So the question is about how the role of the Embrace framework vis-a-vis the launch of the PHN multicultural framework very recently, just the beginning of this week.
It's a great question, and I'm really glad that you've asked that. We've been working very closely with 13 primary health networks across Australia in the last year in really embedding the framework in their own primary health networks. And that's been a really great exercise in showing how primary health networks can increase their cultural responsiveness. So the PHN framework that's just been launched is primarily for primary health networks as organisations. This particular framework that we're talking about today is a fantastic tool to recommend to commissioned services. So services that are commissioned by a primary health service who are working out in the community delivering services, this is the tool that we would suggest to commissioned services that they can really take on, pick up and really use to refine and develop and improve their cultural responsiveness.
Great. And those are the questions that have come through so far via live and also through the registration process. So if there are any other questions, please go ahead and put them in that Q&A box down at the bottom of your screen. We can wait just a little bit, see if any more come in before we wrap up for the day.
And while we're doing that, I'll just go to the next slide. So hopefully we set out this afternoon by asking two quick key questions. What change do we want to see in our services? And how will my service use the framework to achieve change? And I'm really hoping that the conversation that we've had in the last 40 or so minutes has given you some really good hooks that you can take from today and take back to your service and use to improve cultural responsiveness. So we do want to see change in our services. We do want to make them more culturally responsive. We know that it's really important. We know that we need to meet the needs of our communities, and the framework is a great tool to make sure that we're doing that. Just for your information, just really want to highlight again that there's lots of resources and support available through the Embrace team. Some of the resources I've shown you are the the fact sheets that we have available, the introductory module, and we do hold webinars every few months, so be on the lookout for those. We do have recordings of previous webinars on our website as well. Really want to highlight the Knowledge Hub on our website. It's a really good repository of journal articles, project reports, policies from around Australia that will be really useful to you in looking at what others are doing and what best practice looks like. There are the user guides for the framework, which I mentioned earlier. We do sometimes have face-to-face workshops that we offer. If you'd like to come to one of the any of our events, please sign up to our e-newsletter, which it comes out quarterly, and you can sign up to that through our website. If you'd like to talk further about any of the things that we've had an opportunity to discuss today, please feel free to embrace the Embrace Project team, to contact the Embrace team through email, or you can give us a call here at Mental Health Australia. So just another reminder to fill out the survey. I'll just check with Crystal if we've got any more questions.
No more questions.
No more questions.
We've all been
Hopefully all of your questions may have been answered. All right, so please, we'd really appreciate if you filled out that feedback survey. It will only take a couple of minutes and it will come up when you exit the webinar today. Really like to thank you for your time in coming along to this webinar. It's been a really good opportunity for us to continue the conversation about how the framework can be applied in your particular organisation. Please feel free to reach out to us at any time. We'd love to have a chat further. Thanks, everyone. Have a good rest of the afternoon.